Going to the doctor. When you have a need, using your Impact Health Sharing membership is easy. Step 1. Choose your medical provider. No network limitations, just see your preferred medical provider. Step 2. Show your member card. If you have used health insurance in the past, using Impact Health Sharing won't feel a whole lot different. Present your Impact member card and ask the provider to bill Impact using the information on the back of your member card. All of the information that the billing specialist will need is on the card. Our phone number is also included on the card if they have any questions. If they ask what network Impact participates with, let them know that you are free to see any provider you choose. Keep in mind, there are thousands of healthcare options. If your provider hasn't seen a patient with Impact before, they may have to add Impact to their Payer ID system. It is best to ask the provider to call if they run into any problems. Step 3. Pay your provider fee. For non-emergency care, consider using a telehealth provider. $0 for telehealth, $50 for primary care, $75 for specialist, $75 for urgent care, $150 emergency room or inpatient hospitalization. At each visit, pay your provider fee only. You shouldn't be asked to pay for services out of pocket or upfront. If you are, please ask the provider to call Impact at 855-378-6777. Step 4. Receive the care you need when and where you need it. Since Impact does not use a provider network, even while out of town, you can make an appointment to be seen by a medical provider or specialist of choice. Step 5. Pre-notification is required in some cases. Sometimes it takes more than one visit to get you back on your feet. Be sure to direct providers to pre-notify Impact for any of the following treatments to be eligible for sharing: cancer treatments, elective cardiac procedures, inpatient hospitalizations, non-emergency surgery, organ tissue transplant services. Providers must pre-notify by calling 855-378-6777. Pre-notification of medical bills does not guarantee eligibility or sharing. You may still have a few questions. Here are the answers to 2 of the questions we hear a lot. Are routine visits included? Routine care is not eligible for sharing. However, you should present your ID card and have your provider send your bill directly to Impact to receive discounts on your routine services when available. There are exceptions for well baby care, and some preventative services are also eligible for sharing. Check the guidelines for complete details. What if my provider doesn't accept or isn't familiar with Impact? Although this is rare, it can happen. If a provider has questions, it's best for them to call the toll-free number on the back of the member card and follow the provider-specific prompts. From here, the Impact specialist will explain the program in further detail and negotiate if necessary. If a provider denies service, you, as an Impact member, have a couple of options. Offer to pay a deposit towards your service. This deposit would be a medical expense that you can submit for reimbursement. Just follow the instructions in the Member Center to submit a medical expense. Medical expenses that are submitted will be evaluated for eligibility, like any other medical bill. Remember, you must meet your PRA amount before you're eligible for reimbursement. Another effective option is for you to ask the provider for a discounted cash pay alternative and immediately pay the provider at the time of service. Again, you can download and submit a medical expense form from within the Member Center. That expense will be evaluated like any other medical bill, with consideration toward the PRA and co-share. Call Impact directly, and we will help you find a provider in your area that will accept Impact. Keep in mind, Impact Health Sharing's electronic bill processing, digital sharing, and distributed medical reserves enables payment to providers, typically 30 to 40 days after receipt of the member's bills. This approach sets Impact Health Sharing apart from the healthcare sharing process that many providers may have experienced with other healthcare sharing organizations. It is our aim to provide an experience that works better, feels better than insurance for our members. If you have any questions, just reach out by sending us a message online or giving us a call. We are always here to serve you.